A workout has been described as the ultimate way to keep the body in shape. But busy professionals hardly make time to take care of their health. Millions of people hardly stick to basic healthy lifestyle techniques, leading to overweight, stressed out employees whose productivity declines by the day.
When we talk about lifestyle, we are talking about two main things: the things we consume and the amount of physical activity that we do. Those are things that are within our power to change. There are many illnesses that we may have nothing to do about. For example, things that you are born with, some that you inherit. Those ones you cannot change. But there are things that are within our power to change. And that's why we stress on lifestyle, because many of the new illnesses that we are seeing today are to a large extent dependent on our lifestyle. Lifestyle is the way you live. It's what you eat, it's how much physical activity you do.
Experts maintain that a healthy lifestyle is a lot easier than most people think, and in reality it calls for a few changes to a person's daily routine and dietary habits. Tips include more than 5 different fruits a day, drinking lots of water, quitting smoking, taking alcohol in moderation, and getting enough hours of sleep.
I recommend for them starting with simple things. If you work in an office in the 3rd floor or 4th floor, don't use an elevator, walk, take the stairs. Walk, riding a bike, go swimming, or in this case, choose to become a member of a health and fitness center where you have guidance to do the right exercise. Because exercising starts with normal walking. Exercising starts with biking. Exercise starts that you don't use your car for small things. You're going to the shop.
Regular exercising also offers benefits for enhancing health and fitness levels.
Exercising starts in the early years. You know, in the early years when people didn't have gyms, they're working mostly with their body. So exercising was not so important like now, where the majority is sitting in offices, driving a car, so they don't move. And this is why now you should do something on top of your normal daily business to burn fat, calories, to get your cardiovascular system moving.
Socializing is important, and while most people associate drinking alcohol with having a good time, experts are quick to point out that excessive alcohol has huge negative effects on most people's health. So, next time you down that bottle of wine, think of these words.
And therefore, since heart disease and blood vessel disease in general is going to be the major epidemic for the world this century and the next, we must start adjusting on lifestyle to protect ourselves and our children from this cardiovascular disease. These cardiovascular diseases are like mainly heart attacks and strokes, which are coming mainly from diabetes and high blood pressure, which we can control by reducing the amount of calories that we take, eat less, have a diet that is full of or richer in fruits and vegetables, reduce the amount of salt that one takes, and reduce the amount of alcohol that one takes, because alcohol, apart from being a toxin itself, is also very rich in calories.
Over the years, employers have seen huge increases in their medical costs, with most employees adopting desk-bound lifestyles. Medical experts warn that lifestyle diseases such as cancer, diabetes and cardiovascular ailments are rising dramatically in middle-income countries like Kenya and will overtake infectious diseases such as malaria and HIV/AIDS in the next 2 decades.
We are already seeing increasing numbers of hypertensives, diabetics, people who are getting flare of gout arthritis. So it's true that in the next few decades, actually, the whole world population is going to explode into lifestyle-related diseases. It is postulated that by the next 5 decades, probably half the world population may be diabetic because of our lifestyle.
Public expenditures and budgets in Kenya show that health spending stands at about 8% of the total government expenditure. However, the emergence of lifestyle diseases will put a huge strain on the government's ability to ensure the provision of quality, adequate and sustainable health services to its citizens.
If you consider the treatment of a diabetic, you know, that is lifelong. Hypertensive, that is lifelong. that puts the strain on the budget to an individual, to the government. So we expect the strain to be more as the cases rises.
Evidently, every human being has a right to the highest attainable standard of health. Of fundamental importance is the need for people to rise up and follow basic healthy tips in order to lead a healthy lifestyle.